minutes. And I had jotted down 4 or 5 questions that I realized as soon as I wrote them down would probably take the rest of the day for the panelists to engage with. So I want to maybe focus on 2 questions that I think have emerged this morning. And one is, I think, what we have witnessed and experienced this morning, and I've learned over the years is vital to this journey towards health and wellness in communities, is the importance of ceremony. And I wonder if, particularly Joe and Marlene, but Jeff as well, if you could kind of comment on why you do acknowledge the territory, why we do bring elders in. This is not just a ritualistic sort of process. There's something going on here that I think is very meaningful. And I wonder if either of the 2 of you would like to comment on that. I think your mics are live, so.
It's been mentioned already that one of the things that happened in colonization and in the kind of education which was meant to instill a different consciousness in generations of children was that our memory was erased. And what not only we as adults who have been subjected to colonial education, but upcoming generations need to be reminded that we have depth of knowledge stored in different places and stored in our cells and our bodies. And what ceremony does is to situate us as Aboriginal people and situate our friends to recognizing that deep history that has been denied and suppressed and erased even from the consciousness of Indigenous peoples ourselves.
Just a further comment, what we talk about when we do the work in British Columbia is that ceremony is important. We always lead with culture, and recognizing that it is an opportunity to bring ourselves and our partners and our ancestors into the room with us. Also that it's the notion that if we take care of the spirit, the rest will follow. And that's an important element for us around getting us to the same place.
And maybe one other question in terms of, I think all the speakers have touched on this. We're talking in the concept, in the spirit of reconciliation, we're talking about new relationships, basically, between institutions, between researchers and the research community. And that's, again, become kind of a taken for granted notion. I wonder if any of the speakers could kind of comment on what you've experienced in the work that you've done, what constitutes a different kind of a relationship, when you recognize the character of a relationship that you think really works in this particular space.
I'll just start off and say, you know, my experience with the CIHR and Diane Finegood's here, and Alan Bernstein's going to be speaking tomorrow. You know, it was a great opportunity to engage with a bunch of people who were extremely intelligent and also had high ethical standards about treatment of people, particularly vulnerable people. And so the interactions that we had was really life-changing, because we could actually start to share resources to address issues of mutual concern. And I guess I would say that reconciliation should not be hard for Canada, because Canadian values include fairness, equity, equal opportunity, all those kinds of things that we have. And that's all we're really asking for is in reconciliation, is to actually extend what are normal Canadian values that we all share and that we celebrate to, you know, everyone. And so it's not hard for us to imagine a reconciled state. The hard part is actually doing it, and each individually, you know, taking it upon ourselves to be committed to it, and then to work with our children and work with our families and our communities to talk about, you know, how we can move forward with reconciliation. I think, as I say, it's the unfinished business of Confederation. So that's what I say. It's all about relationships.
Both Linda and Joe have talked about authority, power, and I would say in a relationship it's not enough to share good intentions, but you have to create the structures where power is shared. I think that in this historic meeting in August with CIHR and Indigenous leaders from First Nations, Inuit, and Métis, that was made very, very clear that giving advice is not what they want to do. They want to be sitting at the table, they want to share authority, they want to determine policy, not all on one side, but in this two-eyed way of seeing the future.
I think what I would add to that is that in British Columbia, I talked a little bit about the notion of reciprocal accountability, and that not only is it about sharing the power, but it's owning the responsibilities and bringing your best self to that conversation. So we spend a lot of time nurturing these partnerships and relationships and getting to know people over time at different levels. So it is more than about the work, it's about being human beings and being the best that we can be. I think in addition to that, I would say that in the work that we did, I like what Dr. Smith was saying around how our disciplines are limiting to us. And that when you look at the legal agreements in their nature are limiting. They're black and white and they define things a certain way. We've tried to build around those legal agreements a partnership accord, which is it's not a legal agreement, but it's a commitment of people among themselves, government to government, overall, if you will, nation to nation, on equal terms, to envision a future much bigger and brighter than what we think we can deliver through the legal agreement. That allows us to challenge ourselves to grow and nurture our partnership. So we didn't limit ourselves and say, we have our legal agreement now and we're going to stop there, because they always limit where you go. We want it to be limitless, if you will, and allow ourselves to learn together and grow together as part of the partnership and relationship that we have.
Okay, maybe one last question, because I know this came up at a dinner we were at last night, and I know it comes up often, is that what do you see as the sort of likely health outcomes of a change in governance and the sort of creation of self-determining entities like the First Nations Health Authority and other processes like this? And I think the question is often framed a bit too narrowly, that we often don't understand that this is a very broad enterprise that we're involved in, and that health outcomes per se are the product of many other things going on in communities. And the example that I heard last night that's sort of still very fresh in my mind is a 14-year-old niece of one of your staff members who now can imagine, with the presence of the First Nations Health Authority and some of the dialogue that's going on in the province, can now imagine that she might grow up to be a coroner, for example, and that many youth in First Nation communities can't imagine being healthcare workers of any kind, can't imagine being part of establishing these solutions. So I wonder if you could kind of maybe reflect a bit on what does governance really mean, and what sort of effect, what kind of impact it may have in terms of finally gaining some traction on these health outcomes that have been very resistant to change over the last couple of decades.
So I think that the game changer for us was First Nations asserting self-determination. And what happened when that happened was building that consensus around the vision for the work. And because health is an outcome of lots of different things, we have commitments with government to start with health, but are now at the political level implementing discussions on social determinants of health. And so we've been able to look at health as a foundational piece. And as John referenced, we have now a First Nations Health Authority, a very large First Nations public institution, if you will, designed by First Nations for First Nations people that our people are attracted to come and work. So it's creating that sort of notion around it. And as we move into the other areas of social determinants, it'll be similar, where we'll have our own institutions that can work alongside and be recognized as legitimate by the other mainstream institutions as partners. But also I think what's happening that's really exciting is that healthcare in British Columbia is being informed by First Nations knowledge and teachings to help address some of the issues that the healthcare system's struggling with in its own self, as what we would describe as a sickness system. So there's an opportunity to see so much more when the recognition of First Nations governance isn't something to be feared.
Right, yeah.
I think it's extremely important in this new relationship that there are those nodes in the network of services and education and research, where the freedom to actually explore Indigenous knowledge and what it has to contribute, that there has to be those sort of dedicated spaces where ethical research reaching into both worlds can happen. But we're a minority, and we do believe that we have survived these millennia because we have knowledge that is valuable for humankind, not only in the environmental area, but in the human relations area. So what we are looking for is not only the protected nodes where we can do our own thing and enlarge the applications of Indigenous knowledge, but that there is the door open for transfer of knowledge to other systems to actually improve the Western systems that have been oppressive to us in the past.
Jeff, maybe you would like to have the last word and
Sure.
Thank the panelists as you're
I will do that. I guess, it's going to be a difficult challenge. It's a lot of hard work that we have ahead of us. And I think one thing that the lesson from the Royal Commission in '97 and now the Truth and Reconciliation Commission is that we haven't made that much progress despite knowing all the challenges that are ahead of us. But we're now committed to this opportunity, and I think one of the obstacles that stands in our way is frankly racist attitudes toward Indigenous people that we have to confront. And when we pursue equity, when we say we need to actually allocate resources, significant resources to address these problems, ironically, it becomes a challenge to those who have the unearned privilege of, entitlement, and they see equity as a racist policy, which is, completely inappropriate. And so we have to reconcile in ourselves about the place that Indigenous people have and the place we share as Canadians and how we're going to move forward together. So it's really about solidarity. It's about solidarity as Canadians, about how we're going to promote the core values of being Canada. And I think it starts with advanced knowledge. It starts with really smart people turning their attention to social issues and figuring out how we're going to address these problems. So I guess I would, with that note, I hope it's positive, that we thank my colleagues. It was just an absolute honor to be part of this panel. A couple of my heroes here, including John, of course, and to thank the previous speakers this morning. I think we have a whole afternoon together, and I promise it'll be just as stimulating as the morning. And I think, again, I want to thank the President and the Executive of the Canadian Academies of Health Sciences for allowing us to do this opportunity to share our thoughts with you.